Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Hey doctors, what I want to talk about today on today's podcast is a little thing that kind of irks me, and that's when chiropractors and doctors in our profession are looked at as sort of a doorway service to other more important services, such as pain management services or surgical services. And I was just recently at a event, and I kept reaching over to my associate and saying, God, I hate this fact that basically the top doctors in this area, which were the chiropractors, are being used as the lowest level rung providers, as if they're just a doorway mat service to other services, to the so-called real doctors. Here's the thing, I'm gonna tell you right now, if you are in the injury market right now and you can get great results means that in a fairly short amount of time, 2 months, 3 months, 6 months, 9 months, you can actually have the patient back fully rehabilitated and with as little or no problems. If you can do that, and you can do that on a consistent basis, you are gold to this environment. You are gold to this market, because this market is a super expensive market. Chronic pain is super, super expensive. The American Pain Society says if you have chronic low back pain, you're going to spend $9,000 to $19,000 per year medically managing that. The American Headache Foundation says that if you have headaches, you have migraine-like headaches, you're going to spend $8,900 more in additional services. The American Pain Foundation says that if you have chronic pain, you're going to spend about $7,900 more in additional medical expenses per year managing that condition. Doctors, the doctor of chiropractic that is knowledgeable in the injury space is probably the most valuable provider in the whole market, in the entire market. Now, that being said, those doctors in the market, it's the easiest thing in the world to ascend yourself up to being the top. So I want doctors, and I want fellow chiropractors, I want the people in our program, the Smart Injury Doctors program, I want them to be the top level, that the radiologist or the neurologist or the orthopedist is going to go, oh, I need to seek his opinion. I need to see what he thinks or she thinks, because they're able to knock out conditions that we've been struggling with for years. I want doctors to understand that. I'll give you an example. If you take the next 100 cases into your clinic that come in for personal injury, 30 of those or more, at least 30 of those, could be more, are going to have a level of excessive motion that is qualified for spinal fusion surgery, whether it's in the cervical spine or it's the lumbar spine. At least 30. And that's just in our statistics. So when you have a surgical level of soft tissue injury and you're able to stabilize that, and you're able to stabilize that really well, you are super valuable in the market. You're super valuable to employers. You're super valuable to unions. You're super valuable to auto insurers. You're super valuable to people. You're You're valuable to everyone in the market, because statistically, there aren't that many doctors that can do that, right? Because statistically, you look at long-term outcome studies, 10-year studies, 18-year studies, 15-year studies that show, 68, 72, 88% of the people having the same problems that they had from the original injuries. So phenomenal statistics. So if you can do those things, you're top in the market, and you shouldn't be a gateway service to other real doctor services, right? You should be the gateway into where patients should start. And if they start and finish in your office, and the more of them that start and finish in your office, the better, right? That's just my experience, right? So the doctor, you want to be the doctor that doesn't have to rely on other services to be able to get your results. And I see that in my profession, and I see there's top doctors. And, whenever I say top doctors, I'm saying the top 10, 20%. I always wanted to be, not always, at first in my career, I knew I was in, a matter of fact, I had a major epiphany after about 4 years of practice, maybe year and a half of associateship, and then maybe 3 years into my own private practice. So at that time, maybe 4 years into my private practice, I realized I was totally mediocre. I was just an average chiropractor. And I made a decision at that point that I didn't want to be that, and that I would quit being a chiropractor if I was going to stay at that level. And so I made a series of decisions because I didn't want to be that chiropractor. I didn't want to be in the middle of the bell curve. And I also realized that injury patients, they can't afford to be with doctors that are in the middle of the bell curve. But when you start to stand out, you become in the top 20%, top 10%, top 5%, top 2%. You are no longer a doormat to other services. As a matter of fact, other services are going to refer to you because they have so many failed cases. So failed cases will come to you. Acute injury cases will come to you so that you don't have to deal with failed cases. You're going to produce, if you take injury cases in brand new, you're going to be getting the type of results that aren't failed, but you're also going to understand that you can take chronic pain patients or failed injury cases in and improve them a tremendous amount. And then the confidence that comes with that, the certainty that comes with that, elevates you individually up so that you're the top when it comes to a neurologist understanding what it is that you do. You can simply tell them and be effective. Orthopedists, same. Surgeons, same. Pain management specialists, same. Medical specialists, same. Physiatrists, same. Patients, same. So one of the things that I found, though, in order for you to become not a conduit, not within the group, and not even accepting it, like I said, I was sitting in this conference, and I was like, man, every speaker was like, oh yeah, you're going to do the chiropractic care, and then you're going to do the physical. Hey, you're going to do the chiropractic, then you're going to do the pain management. Hey, you're going to do the. So it was like obligatory. Hey, yeah, we know you got to be in here, but you're a doorway mat to other more important services. There could not be a more important service than what you deliver in the market. And if you're good at it, you should be the highest paid providers in the market, bar none. You are the most important in the market. And the most important thing that you can do is get great results with your patients. If you are the one-stop shop, in other words, patients come in and they don't need to go anywhere else. You have them 2, 3, 6 months, 9 months. You have them basically out where they're doing really well and they don't need any other services. You're super valuable. Now, you're not popular maybe, but you're going to be popular with the patient, right? Because I don't care where I go. If you were to ask a patient, what do you want? If I got bad neck pain, I got bad headaches, I got bad low back pain, I got referred pain going into my arm, I can't sleep at night, I'm getting dizzy, I've got dizziness, I've got headaches. What do you want? This has all been as a result of an accident. What do you want? You're going to want the same thing you want. They want some doctor who understands what they have, that can diagnose it, and that can treat it fast and effectively, and then educate me on my own condition and what I need to do to improve it myself and to help maintain it myself. That's what I'm looking for in a doctor. I've never, as an athlete, when I injured myself, I never went, well, who can I go to that can string this along? Who can I go to that can send me to 47 different, 4 to 7 different doctors to string this whole thing out? Like, I don't want that. And most patients don't want that. What they want is somebody that's highly effective with the condition. And that when you are at that level and you're in that top 2%, you're in that top 5%, you are not a doorway mat for services anymore. You're a conduit in. The other services are a doorway mat into your office. And that's really where you want to be. That to me is where all providers in the injury market should be striving. And they should be when they're listening in. Like, I'm listening in to on these conferences, I'm going, wow, these speakers are something. I don't think they're intentionally doing it, but they're very invalidative in a way. Minimizing the role that you have in the market. Your role is the most important, and if you're good at it, you are the most important in the market, bar none. right? Now that's what I teach. That's you're on these podcasts, this is what I talk about. This is where you want to be, right? And it's where we want to help doctors to get to be. That's why we have the Smart Injury Doctors program. That's why we have, if you're interested in it, go out to the site. That's why I do this podcast, so you can listen to these podcasts while you're driving to work and get fired up and go, yes, this is my purpose. Yes, what he said made sense today. Yes, this, when I walk in and somebody's trying to minimize me, what are they going to minimize? Where else are they going to go? Right? I'm the top of the line. I got the top service center in this area. Where else are they going to go? Right? Wherever else they're going to go get failed services, and then they're going to come back to me. That's the attitude, right? So you can ascend up to the top level and feel very comfortable. When you can simply understand the injuries themselves and simply communicate it, you're comfortable in front of anybody. It doesn't matter. I'm comfortable in front of the surgeons. I'm comfortable in front of the orthopedists. I'm comfortable, and I want you to be the same. I want all of our doctors to be the same. I want you to experience the really cool aspect of that sort of certainty and that sort of confidence and that sort of freedom and that sort of calmness. Because it resonates whether you're in those situations in a marketing situation, in a presentation, or in a deposition or a trial. It's really no different. So yes, the injury market has things to navigate, but top chiropractors should not be conduit, gateway services to other services. So that's what I wanted to talk about today. I hope you got something out of it. If you're interested in our program, go to www.smartinjurydoctors.com or call us at 800-940-6513 and check us out. We have I think, a very inexpensive program for what's delivered. We've been told that the program could be, we could charge a lot more for the program. I'm not into that. Very reasonable price for what you're getting. So if you have interest in it, check us out. So, doctors, as always, I appreciate your time. I appreciate your attention. If you're listening to this, I appreciate driving to work. You're giving me a listen. I thank you for what you do, and I look forward to delivering more content on the next podcast.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.